Neuromyelitis optica spectrum disorder, or NMOSD, is a rare autoimmune disease that primarily affects the optic nerves and spinal cord. Imagine your body mistakenly attacking its own communication network, leading to a range of debilitating symptoms. This video will delve into the intricacies of NMOSD, exploring its causes, effects, and the latest advancements in managing this challenging condition. The exact cause of NMOSD is still under investigation, but it's understood to be an autoimmune disorder. This means the body's immune system, which normally defends against foreign invaders, mistakenly targets healthy cells. In NMOSD, the immune system primarily attacks a protein called aquaporin-4, which is abundant in cells of the central nervous system, particularly in the optic nerves, spinal cord, and brain. While genetic predisposition may play a role, it is generally not considered a directly inherited disease. Researchers are exploring potential triggers, such as viral infections, that might initiate the autoimmune response in susceptible individuals. The attack on aquaporin-4, primarily by antibodies, is the cornerstone of NMOSD's pathophysiology. Aquaporin-4 is a water channel that plays a crucial role in maintaining fluid balance in the brain and spinal cord. When antibodies bind to aquaporin-4, they trigger a cascade of inflammatory processes. This inflammation leads to the destruction of oligodendrocytes, the cells responsible for producing myelin, the protective sheath around nerve fibers. The loss of myelin and direct damage to nerve cells disrupt the transmission of signals between the brain and the rest of the body. These inflammatory and demyelinating lesions are what ultimately manifest as the symptoms of NMOSD. NMOSD is considered a rare disease, affecting an estimated 1 to 2 people per 100,000 worldwide. It is more common in women than in men, with a female-to-male ratio of approximately 9 to 1. While NMOSD can occur at any age, it is most often diagnosed in adults between the ages of 30 and 50. The prevalence may vary slightly across different ethnic groups, with some studies suggesting a higher incidence in individuals of African or Asian descent compared to Caucasians. Understanding the epidemiology of NMOSD helps researchers track the disease's occurrence and identify potential risk factors. The symptoms of NMOSD can vary significantly from person to person, depending on which areas of the central nervous system are affected. Optic neuritis, inflammation of the optic nerve, is a hallmark symptom, causing blurred vision, eye pain, and even vision loss, typically affecting one or both eyes. Transverse myelitis, inflammation of the spinal cord, can lead to weakness, numbness, tingling, and bowel and bladder dysfunction. Other potential symptoms include intractable nausea, vomiting, and hiccups, which can occur due to lesions in the area postrema of the brain. Some patients may also experience brainstem symptoms, such as double vision, difficulty swallowing, or facial weakness. Diagnosing NMOSD requires a comprehensive evaluation, including a thorough neurological examination, detailed medical history, and various diagnostic tests. Magnetic resonance imaging, or MRI, of the brain and spinal cord is crucial to identify characteristic lesions. However, the most important diagnostic tool is a blood test to detect the presence of antibodies against aquaporin-4, also known as MOIG. In some cases, testing for antibodies against myelin oligodendrocyte glycoprotein, or MOG, may be necessary, as MOG antibody-associated disease can present with similar symptoms but requires different treatment strategies. Differential diagnosis is also important to rule out other conditions that can mimic NMOSD, such as multiple sclerosis. NMOSD can be broadly classified in two main types based on the presence or absence of aquaporin-4 antibodies. Aquaporin-4 antibody positive NMOSD is the most common form, accounting for the majority of cases. Aquaporin-4 antibody negative NMOSD refers to cases that present with similar symptoms and imaging findings but do not have detectable aquaporin-4 antibodies. Some of these cases may be associated with MOG antibodies, while others remain antibody negative with an unknown cause. The primary goal of NMOSD treatment is to reduce the frequency and severity of attacks and to prevent long-term disability. Acute attacks are typically treated with high-dose intravenous corticosteroids, such as methylprednisolone. Plasma exchange, also known as plasmapheresis, may be used in severe cases or when corticosteroids are not effective. For long-term management, immunosuppressive medications are used to suppress the immune system and prevent further attacks. These medications include azathioprine, mycophenolate mofetil rituximab, and eculizumab. Recently, newer targeted therapies like inebilizumab and satralizumab have been approved, offering more specific and effective ways to block the autoimmune processes involved in NMOSD. Regular monitoring and management of symptoms are also essential to improve the quality of life for individuals with NMOSD. Currently, there is no known way to completely prevent NMOSD, given its autoimmune nature and the lack of a clearly defined trigger. However, minimizing exposure to potential environmental factors, such as certain infections, and maintaining a healthy lifestyle may help reduce the risk of developing autoimmune diseases in general. Early diagnosis and prompt treatment of attacks are crucial to prevent irreversible damage and minimize long-term disability. The prognosis for individuals with NMOSD can vary, but it is generally considered a chronic and relapsing condition. Some people may experience infrequent attacks with minimal residual disability, while others may have more frequent and severe attacks leading to significant impairments. Early diagnosis, aggressive treatment of acute attacks, and consistent adherence to long-term immunosuppressive therapy are essential to improve outcomes. Recent research is focused on identifying biomarkers to predict disease activity, developing more targeted therapies to prevent relapses, and exploring strategies to promote myelin repair and functional recovery. These advancements offer hope for a brighter future for individuals living with NMOSD.